The Morning Show with Zaina.
It is the morning show, and today I have someone that is very special in the studio with me. First and foremost, you guys know I love having guests in with me because, again, I'm talking to myself most of the time. It's nice to have someone respond. I've got Christelle Ziadeh. Oh, see, I knew I was going to get it wrong. Say your last name for me.
I can't help you with that.
Your last name.
No, I know, but the way to pronounce it.
You say it, and I won't repeat it. You go ahead. Last name.
Ziadeh.
Ziadeh.
Okay,
I
said it in a French way.
Oh, what's the Arabic way?
Ziadeh.
Oh, okay. See, that would have been easier for me. Ziadeh. Christelle Ziadeh. Okay. Now we're all going to remember it forever, which is good because we repeated it. And I'm really happy to have you in with me today.
Me too. I'm happy to be here.
And we're talking about something that is super interesting that I feel like, we know what ADHD is, but not enough about it. It's just, it's a term that's very commonly thrown out, but not the details of it. So I am excited to know more about it. So let's start with what it is.
Okay, so attention deficit hyperactivity disorder, which is known as ADHD, is a mental health condition that is often diagnosed in children.
Right.
Okay, so it's difficult for children who suffers from ADHD to focus on their schoolwork, on other tasks,
right.
To pay attention or even to sit still.
Right.
So it's harder for them to control their behavior than children in their own age, which can lead to so many challenges at home or at school,
and maybe even identifying it, sort of, because the thing is, you do have rowdy kids, but there's a difference between maybe being a misbehaved kid or a kid that has ADHD.
Exactly.
But I feel like this is where the confusion lies in identifying whether it's one or the other. So maybe sometimes we very loosely throw out ADHD or don't take it that seriously, but it is something that's very serious.
Exactly. So ADHD actually includes two different types of behavior.
Okay,
so you have the inattentive behavior, which is that the child has trouble paying attention.
Right.
The second one would be the impulsive behavior, which is that the kid has so much energy that they're not capable of controlling their impulses.
Gotcha.
So some with ADHD show only inattentive behavior, other impulsive behavior, but like most of the time it's a combination of both.
Okay.
But like to identify it, the symptoms need to be present more than 6 months.
Oh.
And they need to occur in more than 2 settings.
And those 2 settings are?
For example, home, school, playground.
Visiting teta. It could be like with family members. Okay, gotcha.
Because, for example, let's say that the symptoms only occur at school. It can be interpreted in so many ways. It doesn't have to be ADHD,
It could just be the kid hating school.
Exactly.
And that's it. Nothing more. Okay. So it does have to exist in 2 places. And sometimes you'll find that, school, a lot of kids don't enjoy it. But if it's also like in their comfort zone at home.
Exactly.
Then this is. Okay. So how does this impact them specifically, just in their lives, whether that is at school or in that second location?
Yeah. But first of all, it's important to know that you cannot reliably diagnose ADHD in children younger than 4 years old.
Come in. Okay.
So this is important to know.
All right.
And since we're talking about learning disability, it's important to know that ADHD is a neurodevelopment disorder. It has nothing to do with learning disability. It's not considered as a learning disability.
But it can affect your learning.
Exactly.
Okay.
But ADHD symptoms makes it harder for children to learn.
Gotcha.
And sometimes we can have the combination of both. So we can have ADHD with a specific learning disability. It can be dyslexia or whatever.
Do they usually come hand in hand or not necessarily?
Not necessarily, but like most of the time.
You'll find that if a kid has ADHD, you look further for a possible
learning disability.
Gotcha. Okay.
Yeah.
All right. So obviously this will impact how they learn.
Exactly.
And communicate and...
So, as I said, ADHD is a chronic disorder, and it's known to impact the individual in so many aspects of their life, like academic achievements, interpersonal relationships, or even on the daily functioning.
Gotcha.
So, when it's not treated properly, we notice that the child has poor self-esteem or poor social functioning.
Oh,
yeah, I know.
That's sad.
This is why we exist.
Of course, it's so important to identify that, because if that's starting from the age of 4, or I mean, it's starting before, but you can only start to recognize it from the age of 4.
Yeah.
That going on unidentified in the long run. definitely creates a lot of other deeper issues, I think.
Exactly. And for example, they have a greater risk of poor school achievement,
right,
and grade retention. But what we notice the most is expulsions and suspensions, and this is because the school doesn't understand where all of this is coming from.
Of course,
like, they would judge them and label them as being deviant or being he's
just misbehaved,
being the clown of the class,
right,
or like not being able to follow or understand any instruction. But when in reality they are truly struggling because they literally cannot control their behavior.
Right.
So like a piece of advice, instead of like jumping into conclusions, it's important to identify and understand the source of the problem
in every situation.
In everything, not only with
this
ADHD.
One, do not just jump to a conclusion ever, because you have specialists like Christelle that can help you identify that and not. I mean, listen, again, sometimes that's not the case. Sometimes you do have kids like that, but at least give them the benefit of the doubt that there could be other underlying reasons that we as unprofessionals would not be able to immediately identify. And there are treatments for this. That's the thing.
Exactly. So the treatment, the main goal of the treatment is to improve the symptoms,
of course,
optimize functional performance, but most importantly, it's to remove any behavioral obstacles. Okay, so the treatment is a combination of psychomotor therapy, psychological therapy, and pharmacotherapy.
Okay.
So ADHD medications are designed to affect the brain chemicals in a way that enables the child to control their actions and their behavior.
Okay.
So usually what we do is that we refer the child to a psychiatrist, and he's the one that judges like which medication he's supposed to take, the dosage, everything. And we are responsible for the therapy thing. So what follows. Exactly. So what do we do in therapy? Our main goal is to help and teach the child to control their behavior. So how do we do that? So it's important to let the kids be aware and understand that his thoughts and emotions are connected to his behavior.
Of course.
So once these three dots are connected, the next step would be to provide them with tools that can help them to have a certain behavior accordingly to the situation that they're in. So we approve self-control. So for example,
it all comes hand in hand.
Exactly. So for example, if he's frustrated, instead of having outbursts, exactly, we help him to have many tools that he can use so that he can remain calm,
control his thoughts, have a different outlet.
Exactly.
And see, this is the part that I think people kind of skip over, and why maybe there's a little bit of controversy around putting your kid on medication, because I don't think you can just simply do that and then not follow through with a psychiatrist or a psychologist because again, this is where it comes hand in hand. Getting on the medication, dosing that correctly, but then also talking it through, expressing yourself, working on getting specific tools, and just managing all of that. So you can't just be one without the other.
Exactly.
And that helps.
Exactly, because look, it depends honestly on the severity of the symptoms.
Also, okay.
This is a very crucial criteria that we have to take into consideration, and how much ADHD is actually affecting their life. Like if he's not capable to focus at all, he's full of energy, he literally cannot sit still for a second.
Of course.
We need to take this into consideration. We cannot be closed-minded about that, because he is actually suffering. And I think because we don't see his suffering, like we have this conception of suffering, someone crying or staying in bed, when in reality
or in pain, but it could be internal.
Exactly. If you don't see it, it doesn't mean that it
doesn't exist.
Exactly.
It's so true. And that's the thing, because not taking this seriously can change a kid's entire trajectory in life, where they end up, what schools or universities or lack thereof that they might go to, because there's a limit that we're kind of placing on them, rather than clearing that pathway, identifying it, and dealing with it correctly. So it's also very important to have, I guess, tips in this situation. If you feel as though you're maybe seeing these things in your kids, as parents, what are some of your tips for them?
Exactly. So, what do? Also, we don't only work with the child, we work with the parents so
For
that
sure.
they know how to address the child's symptom. But most importantly, we help them to learn how to encourage good behavior.
Awesome.
Yeah, because we tend as human beings to point out or to focus on negative behavior that we almost forget that even though the frequency of good behavior is low, it doesn't mean that it's not here.
It's not there. It's coming through. You need to identify that as well. You need to applaud that as well.
To reinforce it.
To reinforce good behavior.
In order for it to happen again.
Absolutely.
And not only to reinforce it, but when I give a positive reaction to my kids, I will be sending him a good image about himself.
It's motivational.
Exactly. And therefore, it will help him to have a good self-esteem. Instead of sending him always this negative image about himself, he will feel like he's not good enough or he's not loved.
And he's constantly being punished and kicked out of school and just you're breaking the routine. And that's the thing with most of these things, you need to follow through, work with a professional, and then that has to carry through at home as well. So again, that's the thing. It's all tied together as one community, and that all has to work together in order for it to be truly beneficial in the end.
Exactly. Another tip would be it's important for children to be enrolled in fun activities.
Okay.
Of course, depending on their preferences. With kids who suffer from ADHD, I would recommend sports activities because in that way they would be able to
exert energy.
Exactly. Release all of this excess energy in a suitable environment.
Right.
So this is very important.
Okay.
And next, I would be giving some guidelines about how to give instructions in a way that the child would be more able to comply or to understand. So first of all, it's important to be direct. So as I'm giving the instructions, I need to make a statement and not ask a question. And
it has to be firm.
Exactly. In that way, the kid will know what is expected from him. For example, instead of saying, are you ready to get your homework done now? We can say, please sit.
We're getting your homework done.
Exactly.
Okay.
Just make a statement. Second of all, we need to be close. So I need to make sure that my child is near me and not yelling from across the room for him to come. Because in that way, also, I will make sure that I have his full attention while I'm talking. Third of all, it's important to give appropriate words depending on the level of the age of the kid. And for example, it's important to speak at his level. Like using simple words, using words that he's gonna understand. This will help him to...
So not treating them like an adult. You shouldn't be speaking to your kids as adults. You are speaking to them truthfully and firmly and honestly, and you're being motivational, but you have every age comes at that age for a specific reason.
Exactly.
Okay.
At their level. It's important to stick to their level. In that way, they will understand what I'm saying, what I'm talking about. It's not too complex. Exactly. And the most important guideline in that for kids who have ADHD is to give one instruction at a time.
Come in, that's a good one.
Yeah, we need to avoid giving a series of instruction. That's the worst thing you can do.
Wow. So for example, if you had a check-off list and that's something that they've got at home and it's okay, today this is what we're going to do. You did a good job. You completed it. We tick it off. We move on to the next. That could maybe be something that they could do at home.
Exactly.
Okay.
Especially because it's visual. So this will help them to actually memorize and know what is expected from them. If I say it verbally, they will get confused. They don't have the ability to organize.
To focus on too much.
Exactly.
One thing at a time.
Organize all of these thoughts. I have to do this and that and that. No, it doesn't work.
But that's amazing though, because they're actually quite simple tips when you are aware of them and when you can identify them, that it's such a simple solution for something that could become such a greater problem in their life later on, in later stages of their life.
Exactly.
Wow, that's awesome. You see, I thought that this was going to be super interesting, and it definitely was. It's just good to know for whether it's your kids or your nieces, your nephews, people around you. If you're a teacher listening in right now, it's important for you guys to know at the start of the school year. So all of this was I think it was really beneficial and helpful, and I really enjoyed it. Thank you so much.
Thank you.
It was lovely meeting you. You're welcome anytime. Maybe we'll do another segment where we continue to give tips, because I think parents are going to absolutely love this.
Yeah.
Also, it's a massive shout out, of course, to CLES for providing and setting up this interview, for bringing you Art by CLES, because this is all in honor of the fact that we are running the local artist competition as well right now. Really excited for the finals. And Christelle, thank you again so much for coming in.
Me.
We're going to get back to the hits. Keep it locked in.